Hi, welcome to TAG Physical Therapy's mini wellness workshop. I'm Megan Golden, physical therapist. Today we're going to be discussing one of my very favorite activities, sleep. Unfortunately, many people report difficulty sleeping. The good news is there are a lot of actions you can take during the day that will help promote better sleep at night. Sleep quality and quantity can benefit from good behaviors during the daytime. We do recommend that during the daytime you exercise regularly. No matter what exercise you like to do, just make sure that you don't exercise too close to bedtime. Additionally, if you're somebody who likes to nap, it's fine. Just make sure you set a timer and try to keep your naps to less than 20 minutes. Time to wake up! During the day, there are many different drinks that people like to consume. If you're somebody who likes to consume caffeinated beverages, we do recommend that you keep your caffeinated drinks to only the morning time, avoiding caffeine intake in the afternoon or the evening, because drinking caffeine at these times of day can interfere with your sleep. If you're somebody who enjoys alcoholic beverages, we do recommend that you try to minimize your alcohol intake, if not completely eliminate it, as alcohol intake can also interfere with sleep. And of course, it's important to stay hydrated with water throughout the day. We just recommend that you minimize or eliminate water intake right before bedtime. Other things you can do are to make sure that you turn off the lights during bedtime, and if you're somebody who likes to spend time on your screen before bed, we do recommend that you also turn off your screen devices at least an hour before sleep. Also, make the bedroom environment a cool, comfortable, quiet, and dark environment, and keep the bedroom for bed activities. It's best not to work or enjoy other recreational activities in bed. Next, we'll discuss pillow use and sleeping position to promote healthy sleep. Join me. Many people in physical therapy experience sleep disturbance and often ask what they can do to promote more comfort while they're sleeping. Many people have questions about positioning and pillow use. In terms of positioning and pillow use, there's no one right product or one right position that's always the correct one to use. It may depend on how you're feeling at that time. There are, however, a few guidelines you can use to position yourself to promote the best sleep. The main principle has to do with using pillows to support yourself in a neutral position. For the neck, a neutral position is pretty much the one I'm in right now. It means you're not side bent, your head is not turned, and your head is not tipping down or tipping up. Sometimes when lying down, this is easier said than done. I also think of neutral and how it applies to the rest of the body, to the spines, the shoulders, the hips, the knees, the elbows, and the wrists. Imagine neutral, the position you find yourself in when you're comfortably floating in water. I also think of neutral as the position we see astronauts in when we see footage of them in space. In terms of pillow use, there are many options that can work well for people. Some people like to use contoured cervical pillows. The design of this pillow is that it has a thicker edge on one side and a thinner edge on the other side. The thick edge is to support the curve of the neck, whereas the thinner edge is where your head would rest, your skull. Neck area, skull area. This pillow has a fairly thin support and is designed to sleep on the back, because when we're sleeping on our backs, we really don't need our heads lifted very high. It's best to choose a thin pillow if you're somebody who likes to sleep on your back. As you can see, this contoured pillow has a slightly thicker thick edge, and again, a thinner thin edge. This is made for a side sleeper because when we're sleeping on our sides, there's more space to fill in between the bed and our neck than there is when we're lying on our back. You don't have to use a contoured pillow at all. It may be that a feather pillow that you can scrunch up the right way works for you. It may be that inserting a rolled towel into your pillowcase to give a little extra support for your neck works for you. In terms of sleep position, we do recommend sleeping on the back as the position that can most easily promote neutral spine posture. It's also a position that can easily be adapted to put support under your knees if you have any hip or knee discomfort. If you're a side sleeper, you might consider using pillows between your knees or under your legs. I'll demonstrate that in a moment. Finally, lying on the stomach is the position we recommend the least because it's very difficult, if not impossible, when lying in a standard bed to have your head and neck in a neutral position. For many people this isn't a problem, but if you are experiencing injury or discomfort, lying on your stomach can exacerbate your symptoms. Here I am lying on my back. I have placed the small cervical pillow under my head and neck to support me in neutral, and I've also placed a pillow under my knees. For some people, placing a pillow under the knees may improve the comfort in your low back, your hips, or your knees. If you have shoulder discomfort, you may also find that using a pillow under the arm in a way that raises your arm a little bit and places your arm a little bit away from your body can improve the comfort in your shoulder. If you're somebody who likes to side lie when you're sleeping, a slightly thicker pillow is recommended. Here I have the medium cervical pillow. You want to have your head and neck supported in neutral rather than side bent or rotated. Also make sure that your head's not tipped back or tipped forward when you lie down to fall asleep. A pillow between the knees can improve comfort in the low back and or the hips. Again, if you have shoulder discomfort, you may find that an extra pillow to support your arm comes in handy. I hope you found these sleep tips helpful today. If you think you may have a sleep disorder, it is best to consult your healthcare provider. If you're having severe pain or discomfort that is interrupting your sleep, we also recommend that you consult your healthcare provider. Thank you for joining us, and we look forward to seeing you next time. Sweet dreams!